So as Rita said, my name is Seth Bernstein. I'm also here, as Pam was, with a number of hats. Today I'm representing the Action Alliance, but I'm also representing a group called the School Health Advisory Council, and I'll tell you a little bit about that group. I'm also a psychologist and certified addictions professional by trade, and I'm a program director at a not-for-profit, so I share that nonprofit experience too. I've worked in government entities and all different kinds of settings. I'm also a consumer, and I have mental illness in my family, and my child has Tourette syndrome, and a host of other things that go along with it. So I'm involved in that way in the community as well. But anyway, this survey went out in 12 elementary schools from throughout Palm Beach County. About 3,000 third and fifth graders, yes, third and fifth graders were surveyed, and 90% of the surveys from those students came back. About 2,700 parents were surveyed, but unfortunately we got back less than 20%. And then about 800 school personnel were surveyed, and about 50 or 60% of those surveys came back. So it was it's not a research designed, statistically measured survey, but there have been very consistent results over the last 3 years that we've provided the surveys. So I'm happy to talk to you about them a little bit. And there are 10 questions of the survey. We only presented to the school board on 5, and I'll really summarize 3 for you. But some of the questions that we asked were like, to the students, if you were really worried about something, who would you go talk to? Okay. Another one was, if you had been bullied by other students, is there a caring adult that you would go talk to? How many times have you been bullied on school property? Do teachers and other adults at school really care about you? And do you or your child or your students feel safe at school? Okay, kind of questions that are asked in other surveys that are done around the country and in Florida. And some of the results that we found are around the bullying, that for third graders, about 1 in 5, about 20%, consistently over the last 3 or 4 years, have said that they've perceived to have been bullied more than 4 or more times. So 20% of kids in elementary school. So if there's 100,000 elementary school students, if you work that up, there's 20,000 students are saying that they've been bullied 4 or more times. One of the, just as a comparison data point, there's a national study that says that about 40% of middle school kids in their lifetime have said that they've been bullied at least once. My guess is it's probably it's happening. It's happening much more frequently than it has before, and this can have very devastating effects on kids. Then you look at kids who have disabilities, and that statistic probably doubles. You look at kids that are struggling with their sexual orientation or their identity, and it's off the chart. And these are the kinds of things that we're reporting on, and that we will hopefully take a look at more through our School Health Advisory Council. Another question that I mentioned was kind of that school connectedness. So kids and parents, say that when kids are worried, they talk to family members, and teachers think they talk to teachers, which was interesting. And then the other thing was that about 1 in 5 students, again, about 20% of students, say that they have not felt safe at school at some point in time. So there's this 20% kind of thing that we've seen over the years, and it's fairly significant. There was other data that was presented to the school district that very much aligned with what the School Health Advisory Council survey said, and there was also discussions around what services the district has available to our kids and to our families, but also, what was brought up was that, educating students in general is not just a school district effort, and that's from a community member saying that. For kids to be successful in school, it takes schools, it takes communities, it takes families, and it takes the kids, of course. And there was a lot of talk about how, what the district needs to do differently, but also how they can work with community organizations and community members alike to help kids be successful. On the Baker Act data, just wanted to throw that out there real quick. And I want to get this right. The number of Baker Acts to West Palm Hospital over the last 5 years has significantly gone up. And I'm going to tell you exactly what the numbers are. From 5 years ago, there were 972 Baker Acts, child and adolescent Baker Acts, to West Palm Hospital in 2007. In 2011, 2012, there were 1,378. So 972, 1,378. And they also have been tracking the Baker Acts from schools, from school police, and it went up from 131 to 190, okay, in 11-12. I'm going to tell you real briefly about some of our recommendations, and they coincide a lot with what Pam and hopefully the Health and Human Services Coalition will go along with. And one of them is training. We've already spoken with the school police chief, and he's on board with the community, including Shaq, doing training on how to prevent Baker Acts. How do you de-escalate kids? How do you verbally de-escalate kids? How do you talk to kids so you don't press those buttons? If they have sensory issues, how do you give them a few minutes to kind of calm down and be in their own space, and then ask them to join the class again? And how do you teach them to be much more sensitive and appropriate to kids who are having mental health and mental illness issues? So training was one thing that we talked about, not only for Baker Acts, but about mental health in general of our students. And how do we recognize when kids are having mental health issues, and then how do they go about making appropriate referrals for those kids? And they do have a system in place to do that, but we feel that it can get even stronger. Another recommendation that we made to the school board was to allow school counselors to follow the National School Counselor Guidelines. In many schools, counselors, they wear many hats, probably 10 times as many as me perhaps, but they do not have enough time to be there in their schedule for kids, and for kids especially that are struggling with mental health issues. Some of the other things, we're increasing some of the bullying prevention resources that we have available in the county, maintain programs that work, and even expand on programs that help kids throughout their trajectory in school. And there was a very strong recommendation about endorsing the fact, and some people will still disagree with this, that social, emotional, and behavioral issues impact academics. Does anyone disagree with that? Raise your hand, because I'd like to see it afterwards. Nobody? Okay. Well, there's still a lot of people that think that. And some people think the head and the body are still not connected, which is amazing. But they were very open to the recommendations, and we're going to be having some follow-up dialogue with them, and the School Health Advisory Council will be active with that group. And as Rita said, she is very active on the School Health Advisory Council and the Mental Health Subcommittee. We're always looking for new members, new energy, and if anyone is interested, you can certainly be in touch with Rita, and she can put you in touch with me. I'm sure I'm well over my 5 minutes, Rita, but I do want to say that I agree that more opportunities to talk about mental health issues and how we break the silence and the stigma that I think Ross was talking about is very, very important, and I'm glad to have been asked to be here today. I do want to thank the foundation. In the late 90s, you actually had the first social worker in a school, and that was actually, imagine that. Who had social workers in their schools coming up? I did. Nobody else? Yeah, several people did. We had a nurse in our school too. What better way to take care of kids' social, emotional, and behavioral health kinds of issues? So I used to work at the healthcare district and was extremely familiar with the foundation's work, and just want to say thank you publicly for that. So I'm happy to take questions or leave the stage quickly, either way. Rita?
There was another survey done in 2011 of secondary students.
Yep.
Do you have those findings?
Sure. Rita's talking about the Youth Risk Behavioral Survey, which is really a surveillance survey of middle and high school kids, and it's done throughout the state. 5%. And over 8% of students ever tried to kill themselves. This is self-report by middle school students. High school students, 15.5% of them had ever been bullied on school property during the past 12 months. 8.2% of students did not go to school on one or more of the past 30 days because they felt they would be unsafe at school or on their way to or from school. Going to school is very important, isn't it? And a quarter, 25.3% of students felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some usual activities during the prior 12 months, including going to school. And 8.5% of students actually attempted suicide one or more times during the past 12 months. 8.5% of high school students. So I don't know exactly how many high school students we have here, but even if it's 30,000, that's 2,400 kids have actually attempted to kill themselves. Yes, ma'am?
Do you have social workers and psychologists working in schools now here?
The school district employs psychologists. I'm not sure what the ratio is. They would probably agree that it's under ratioed based on the national standards. There are not enough school psychologists. They typically are doing testing and placing of students versus intervention. They're there to do crisis management kind of stuff, but it's rare that psychologists have time to do groups and individual work. Every school has a school nurse, thanks to the healthcare district and health department and school district pay for nurses. But other than that, school district has a handful of social workers, and they're primarily working with the most at-risk kids, the ones that are kind of in the exceptional student education program and have emotional behavioral disturbances, EBD. Yes.
I just wondered if the Alliance is aware of the group counseling center on Boca Rio Road that provides a wonderful resource. It's a private, nonprofit organization run by charities and has groups and individual counseling. Most of the groups are $5 or no fee at all. They go out into the schools, and they also have groups in the counseling center, in the building itself. So until all of this it's just good for everyone to know about it.
Sure. The school district has about 33 memorandums of agreements with nonprofit agencies. I'm sure the Center for Group Counseling is one of them. But it's certainly a resource right here, along with, there's multiple agencies. I know they're known for going into schools. And the Action Alliance hasn't talked specifically about, that particular agency, but, it's certainly something that we can do and share that matrix that the school district has of those programs. Yeah, thank you. Thank you very much. Appreciate your time.